Hey, welcome to the show. Today I have a very, very special guest, Dr. Jennifer Simmons, who's going to be sharing her wisdom on all things breast health. Dr. Jenn Simmons is a breast cancer surgeon turned integrative oncologist on a mission to change how we diagnose, treat, and screen for breast cancer. Her best-selling book, The Smart Woman's Guide to Breast Cancer, which I am currently reading and loving, is changing the narrative and will change the lives of millions of women worried about or affected by a breast cancer diagnosis. She's opening the first Perfection Imaging Center, which accurately screens for breast cancer using revolutionary new technology without pain, compression, or radiation. Welcome, Dr. Jenn.
Thank you. Thank you so much for
I'm
that
so happy
lovely
to have you.
introduction. I'm
Yes.
I'm happy to see you with the book. I'm
Mhm.
glad that you're enjoying it.
I was eating lunch earlier and I realized I didn't have like any vegetables. And I was like, what am I doing? I'm eating protein. And then I was like, gotta eat more vegetables.
Gotta eat more
Even as a
vegetables.
health coach, sometimes it's like you just forget those things.
Yeah. I run a group for women who are on their breast cancer journey.
Mhm.
And we were talking today, and one of them mentioned that her nutritionist, when she was first diagnosed, put her on keto. And
Mhm.
like my whole body kind of cringed because, and listen, I don't think there's one right diet for everyone. I
Mhm.
think that everyone is bio-individual, definitely. But in general, women don't do so well with keto
Mhm.
because we need carbohydrate in order to make the hormones that we need to make for our bodies to function properly. And men tend to do much better with keto, which is like another example of how men's systems are far more simpler
Mhm.
than women's, and men are definitely much simpler than women across the board.
Yes.
And so, I'm not like male bashing, but it's
Mhm.
just the truth.
Yeah.
And so women generally don't do so well with keto because we actually have an inherent need for carbohydrate.
Mhm.
And I'm not talking about eating bread or cake or cookies or anything like that, but that we actually need the carbohydrates from vegetables and fruit in order for our bodies to function as they're supposed to function, in order for us to make our hormones the way that we're supposed to make our hormones. So I totally understand that we have a need for protein. I get it, but we also have an inherent need for carbohydrate, and that comes in the form of our vegetables and our fruit. And the bonus is that that's where all the nutrients are for us anyway. Like
Mhm.
that's where all the vitamins and minerals and antioxidants and
Yep.
like all the things that we need to be healthy are there.
Yeah.
So it's a good reminder to get your vegetables in because your body actually needs them.
Yeah.
Yeah.
Exactly. And it's so ingrained in us, especially in women. When women, this is a show that's focused on perimenopause, but in the stage of life, counting your macros and making sure you're getting protein. And I'm always reminding our clients of that, like, hey, how much fiber did you get today? I'm talking about from
Yeah.
fruits and vegetables, and don't be
Yeah.
afraid of fruit.
Yeah.
So yeah, we really drill that into them. And somebody, again, like I'm very busy, and some days it's like it's so easy to like throw something together, but then like, oh no, like I need a salad on the side or whatever, like roast a bunch of
hmm
vegetables. And then
hmm
I realized like, oh my gosh, my body craves them. It's like when you eat them, you're like, yeah, like this is what my body needs. So
I know.
yeah.
I know.
Anyway, we could
And
talk about food for an hour.
yeah,
But
clearly.
yeah. I want to dive into I have a lot of questions for you, and obviously why you're here and why you wrote this book, which is obviously so, so needed. And the topic of breast cancer. So many women have fear around it, and rightfully so. It's very prevalent in the US. So
Yeah.
like, how prevalent is it in the US, and should we be as afraid of it as we are?
Yeah. So, I mean, I think that that conversation is all relative. We definitely need to be aware of breast cancer and what causes breast cancer. But the interesting thing is that women die exponentially more of heart disease than they do of breast cancer. And yet, so many women fear breast cancer exponentially more than they fear heart disease.
Mhm.
And so right now, the numbers are looking like 1 in 7 over your lifetime will have breast cancer. But those numbers are just going to increase, but at the same time, so are the rates of cardiovascular disease because we are living in an increasingly more toxic environment, and our lives and our lifestyles are becoming increasingly more toxic. And this is not a recipe for health. This is a recipe for sickness. So, I always say breast health is health, and the same kinds of things that are going to give you healthy breasts are going to give you a healthy heart, a healthy brain, healthy skin, healthy bones, healthy joints, healthy gut, healthy vagina, healthy bladder. It's all the same thing.
Mhm.
And it's those things that drive health, those pillars of health that we have to continue to put in place and keep in place in order to maintain our health. So, ultimately, we need to be so aware and vigilant about what we're putting in, on, and around our body. And that goes for food and drink as much as it goes for all the personal care products, as much as it goes for what you're cleaning your house with, as much as it goes for, the electromagnetic field that's around you, as much as it goes for the people and circumstances that you surround yourself with. So, I've had many a patient who wound up in my office with a breast cancer diagnosis because it was the only way that they were getting out of their marriage, or the only way that they could give themselves permission to quit that job that they hate,
Mhm.
to leave that boss that is torturing them.
Yeah.
It's the only way that they could get out of a relationship that was really harmful for them.
Mhm.
That's their out. Now, some people, I have a patient who I'm working with currently who literally I think is going to die of her breast cancer because she won't get out of her toxic marriage,
Mhm.
and death is her way out. And I see the writing on the walls.
Mhm.
And um, it's a horribly sad and tragic situation. And I'm sorry to say it's not uncommon
Yeah.
that when, emotional pain, without question, when not dealt with, will manifest in a physical way.
Absolutely.
And I see it all the time. So I think the most important thing for us to be asking ourselves is, how do we feel? Dial in, and what is working for us and what is not. And so often people do not ask that question until they're put into this horrible situation, right? Like most people are not asking, am I doing the things to stay healthy, until they get a diagnosis,
Right.
right? That's their wake up call. Now, from my perspective, you can either see that diagnosis as a punishment and kind of go down that rabbit hole of why me and why is this happening to me, and it's okay to ask those questions, right? Like it's definitely okay to ask those questions. But the better question and the better perspective is, this is an opportunity for me. What am I missing? Right? Like, what is the message here? What am I meant to learn? What path am I on that's the wrong path for me? So,
Mhm.
if you can use your diagnosis as opportunity, it leads to amazing things for most people that can embrace it like that. It really does. I
Yeah.
mean, at least for me, from my perspective, I was at the top of my game when I got sick.
Mhm.
I was at the top of my game. I don't think there's any way in the world that I would have left.
Wow.
I just don't think there is. I mean, when you're cruising down the highway and you're in your convertible and your hair is blowing in the wind and it's a gorgeous shiny day, like why are you changing? You're not,
Yeah.
right? And that's where I was. I was
Mhm.
cruising. I was the absolute leader at the top of my field,
Wow.
but it wasn't meant that's not what I was meant to do with the rest of my life.
Mm,
And so, and I was also not recognizing that you can't burn your candle at both ends indefinitely. Right.
yeah.
And so, and I was completely ignoring all of the signals from my body, completely ignoring them. So, in my estimation, I went from like on the top of the world to incapacitated in 3 days. But maybe I didn't,
Right.
right? Like maybe I just, I was exhausted, but pushed through because that's what we do, right? That's what super um, highly effective people do, right?
Mhm.
They just push through. They just get it done. That's
Yeah.
what high performing means, right? You
Mhm.
just you just white knuckle your way through it. And I never would have changed had I not been forced to change.
Yeah.
So, you know, I still don't know if that is something that even I am capable of now, having like seen the whole thing. But most people are not looking to improve until they have to improve.
Yeah, I see that as well. I mean, most women are coming to work with me because they've hit a wall and
Yeah.
they're just like at the point they're like, I can't take it anymore.
Yeah.
And it's like, and then they expect to like have everything turn around in a few months. It's like you've been doing this for years
Yeah.
and your body is finally screaming. It's been whispering, but
Yeah.
you've been ignoring it. And we all have. I've been there myself. I burned out in my early 30s because I was just go, 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 under eating, overwork, over exercising,
Yeah.
thinking that's what I was supposed to do.
That's
That was
the
health.
perfect recipe,
Yeah.
right? The
Yeah.
perfect recipe. And I mean, even the biohackers of the world, even the Dave Aspreys of the world, right?
Mhm.
He's only Dave Asprey version, 201 or
Yeah.
301 or whatever version he's on right now.
Mhm.
Um, because the one-on-one version was 300 pounds,
Right.
right? And like nearly dead in his 20s.
Mhm.
So, we all I I don't know what it is about the human condition, but we all have to really fail before we
Mhm.
can succeed. I was lamenting about that a little bit to my best friend last week that
Mm.
like why does life have to be so hard? And she, in the kindest of possible ways said, "Are you really going to accomplish all you're going to accomplish if it comes easily to you?"
Right.
If it comes easily to you, you're going to be in Europe with everyone else that's vacationing, but instead you're here, you're
Right.
here in the grind because you have work to do.
Yeah.
So, yeah, I mean, listen, life is hard for everyone.
Mhm.
If anyone is out there looking at my Instagram feed and thinking that my life is easy, I'm going to assure you right now that it's very, very hard.
Yeah.
But the rewards are amazing,
Yeah.
right? Like when you reclaim your health, even though it
Mhm.
takes a lot to do it, when you
Mhm.
reclaim your health, it's amazing because everything else wins, right? Like when
Yeah.
you reclaim your health, you reconnect to your spouse, you have more meaningful relationships with your children and your friends, and it allows you to be present in a way that you can't be when you're sick and in pain and hurting.
Right.
And when you are sick and in pain and hurting, it's nearly impossible to be well. It really
Yeah.
is.
Yeah. And you can't do the work that you want to do in this world.
Mm,
And I say that because I know a lot of women who listen to this are, working, whether they have a business or they're in their careers. And a lot of them love the work that they do, but they're also depleted. And
mhm.
especially in this
Yeah,
stage of life, in your 40s and beyond, things start to shift. Obviously, from a physiological perspective, your hormones are changing, but I think with that just comes this whole shift, even in like a lot of the questions that you were saying, like you start asking yourself, like, is this what I want to be doing? Is this serving me?
yeah,
Can I be doing something different? And it's like a beautiful time for women, but also really, really challenging because
yeah,
they're raising kids, they're taking care of aging parents, they're going through this huge shift. So it's just a lot. And like you were
yeah,
saying, if you keep going and grinding, like at some point your body's gonna just like shut down.
yeah. Well,
Yeah.
and it's also, that perimenopausal time, there's a huge metabolic shift. There's a
Mhm.
huge hormonal shift. And what you did and how you did it in your 20s and 30s starts to not work anymore in your 40s and 50s.
Mhm.
And, I remember like I could lose 5 pounds in a weekend, you know? When I was in my 30s, I just knew like if I had a wedding to go to or if I had a something to go to, like I could diet down in a couple of days and get into that dress that I only
Right.
wear on my thin days, you
Yeah.
know?
Exactly.
Um, but that really starts to not happen anymore. It's not so easy anymore. The the biggest thing that I noticed for me, and it's like a consistent thing across the board with my patients, is that um, when you start to lose muscle mass, things really change for you, really
Yes.
change. And life gets a lot harder. And it really, you know, so much of my learning, and I think this is probably true of all health professionals, is you learn so much when you go through it yourself, which is why my being a patient was so impactful to me, so much so that it made me leave surgery. I mean, I literally went from being at the top of my field to being incapacitated. And, when I was at that time facing surgery and chemo and radiation and all the things that I told people all day, every day that they needed, and I told them this without hesitation or reservation. But when those words are coming at you and you're like, the chief of surgery and running the cancer program, it's like this cannot be my reality, right?
Mhm.
Like I know that I say this to everyone, but that's them. This is me. And though it was so hypocritical, I walked out and refused treatment because I the first thing that everyone asks you when they get a cancer diagnosis is why, right?
Mm.
And I used to tell people, oh, it's multifactorial. It's nothing that you did. And it's not anything that anyone does, right? This isn't about blame or shame because no one intentionally gets cancer. Like even people that smoke, they don't smoke with the goal of getting cancer,
Right.
right? Like no one does this intentionally. But we make people think that they have no control, that this
Mhm.
is something that just happens to people. And while that was an acceptable explanation when I was doling it out to everyone else, when it was coming at me, I was like, no, no, not enough of an explanation. So I
Mhm.
go on this big exploration to try to discover why I'm sick and what I can do. Is there something more to it? Like, or do I just kind of hand over my health to someone else? Because
Mhm.
that's what's really happening in the conventional medical system is we are farming out our health to people that have no idea how to take care of it,
Right.
right? And it's not like I knew that there was something else, but I did have this voice in my head which was telling me like go explore this. Go find something more. Go find answers. Like if these aren't acceptable to you, go find the answers that are. And I was so lucky in the beginning of this exploratory journey. I'm in a lecture hall and this tall lanky guy walks on stage, big toothy grin, and he introduces himself as a functional medicine doctor.
Mm.
Now, I'm about 20 years into being a physician at this point.
Wow.
And I'm like, yeah, there's no such thing as a functional medicine doctor. So, what is
Right.
this quack talking about?
Mhm. Yeah.
And then, I remember that I'm sick and I'm there for a reason. So, I need to check my ego at the door and like stop that snooty booty voice inside of my head. And I tune in and I listen, and I spend the next 3 hours of my life being blown away by this man. Because not only was he telling me why I am in that chair that day, like, not only is he helping me to realize what's happening with me, but he's also going to telescope the next however many decades of my life because I know in that space and in that time that I was absolutely 100% meant to be there. And that's
Yeah.
exactly why I got sick, so that I
Hmm.
could listen to Mark Hyman speak,
Yeah.
because this is 2016.
Hmm.
And I had no idea who he was now. Now,
Yeah.
now, of course, I know who he is.
Right.
But in 2016, I had no idea. I'd never heard of functional medicine. Like, I didn't know. But
Yeah.
here he is talking about root cause medicine.
Hmm.
And what I realized in that time and in that space was that in medicine, we're all focused on the symptom. No matter what fraction of medicine that you're talking about, we're all focused on the system. In the area of cancer, we're focused on the tumor. Everything's
Hmm.
focused at the tumor. But the tumor's not the problem. The
Yeah.
tumor is the symptom of the problem.
Hmm.
And nowhere in my medical training was I ever taught that. Nowhere in my graduate training was I ever taught to focus on anything but the tumor,
Hmm.
right? So, as a surgeon, I'm basically just taking people over a bridge from sickness to sickness, because I'm not doing anything to materially change the trajectory that they're on.
Right.
So, yes, I cut out the tumor and maybe I delay the progression of that disease. But the underlying problem, the underlying inflammation, the underlying nidus is still there, doesn't change.
Yeah.
And so, I decided that day that I was going to become a functional medicine physician. And I enrolled in the Institute for Functional Medicine. And I spent the
I
next
love it.
3 years just absorbed in the study of
Wow.
functional medicine.
That's incredible.
And when I finished, I mean, of course, like, thank God, by the grace of God, I was able to heal. And I do want to say that it got a lot worse before it got better. And I did not get the help that I should have gotten.
Mm.
And I went through 2 very, very scary, harrowing years. So I don't recommend taking that journey alone. Like, in retrospect, I should have gotten help immediately, but I didn't. But at the end of 3 years, when I got my certification, it was a bell that I couldn't unring. Like, I couldn't go back. I
Right.
couldn't, I saw being a surgeon as two things. I mean, primarily, I saw it as being a part of the problem, because if you just continue to go along, then you're not making an impact. And I did try for a little while to be both.
Mm.
But, as a surgeon, I mean, most surgeons these days are employed. I was an employed surgeon. I worked for a hospital, and they don't pay you to talk to people. They
Hmm.
pay you to be in the operating room. But, how am I supposed to get people to change the way they eat and change the way they sleep and move and think and all of that with the 15 minutes that I was allotted to talk to them? Like, you can't. I
Right.
mean, we can only get through a fraction of our conversation in an hour's time, right?
Right.
So you can imagine what it was like. And I kept trying over and over again, and just realized that it wasn't going to work.
Right.
And so in 2019, I left and I started a functional medicine program for women who were going through their breast cancer journey, to give them the end. Because to me, everyone who gets a breast cancer diagnosis, they get a treatment plan, right?
Hmm.
But what they all need and never get is a health plan. And
Exactly.
so I wanted to give them the health plan. And I spent, 4 years doing that. And it's amazingly rewarding in the one on one space, definitely. But I wanted to change the lives of millions of women.
Yeah.
And that's why I wrote the book, The
Yeah.
Smart Woman's Guide to Breast Cancer, because I wanted to give everyone that knowledge, that opportunity to do the end,
Hmm.
because it's what everyone needs. What everyone needs is a health plan. And
Yes.
then, so just getting back to that time, that perimenopausal time, when your hormone levels are diminishing in general, although there are times of great hormone spikes. And so women become so, so, so symptomatic. And I started to look into hormonal assistance, let's
Mhm.
say. And, there's so much talk around estrogen and its
Mhm.
role in cancer.
Right.
And we have a lot of convenient explanations, right? Like we give people these narratives that we think just are easy to understand and make sense, but they're mostly there for they all have a purpose, right? So when the Women's Health Initiative study was done, it was done in the early 2000s, and the intentions of the study from the very onset were to get women away from hormone replacement
Yep.
because with hormone replacement, we are meeting a lot of needs and eliminating a lot of need for a lot of pharmaceuticals.
Correct.
And the drug companies don't like that.
Mm-mm.
And so, and there have been multiple statements about, why should women go on hormone replacement when we have perfectly good pharmaceuticals that can manage these things? And, they don't talk about the fact that most of the pharmaceuticals are not effective in most women. And even if they are, they're not nearly as effective as hormone replacement. So, why put someone on hormone replacement when you can give them beta blockers because they have tachycardia and palpitations? You can give them statins because they have elevated cholesterol. You can put them on antidepressants because they're depressed. You can put them on anxiolytics, anti-anxiety medications because they're anxious. You can put them on sleep medications because they can't sleep because they have a lack of progesterone. You can put them on bisphosphonates because they're losing their bone mass. You can put them on nonsteroidal anti-inflammatories because all of their joints hurt. You can put them on alpha blockers because they have urinary incontinence. You can put them on, lubrication medication because they have vaginal pain and atrophy. You can recommend laser stimulation because they have vaginal pain and atrophy. And, I can go on and on and on.
Mhm.
Or you can just put them on hormone replacement, which is,
Gosh,
when you go
it's
on bioidentical
infuriating.
hormone replacement, it fixes all of these things. And the whole thing is so infuriating and all done under the guise that hormone replacement causes breast cancer.
Right.
And so we created decades of hysteria.
Mhm.
And the biggest problem that I see with that, first of all, I mean, millions of women suffered for 20 years.
Yes.
20 years, millions of women, and
Mhm.
continue to suffer. And the reason why is that we have 2 decades worth of physicians who were trained with that mentality. And
Right.
I'll tell you that, I came out of training in 2003. I was trained by a brilliant man who was one of the world's leading breast cancer physicians. And he taught me 3 things with regard to hormones. He told me that hormones cause breast cancer. The only people that should be on hormone replacement are the people that absolutely positively cannot live without it. And if you put said people on hormones, you should give them the lowest dose for the shortest period of time, right? And if I'm being honest, for 15 years of my career, maybe more, I don't feel like doing the math right now, but let's say around there, maybe a little more, maybe 17. Um, I I practiced with those thoughts in my head.
Yeah.
And never did I think that what he was telling me wasn't true or, shouldn't be respected. And so for most of my all of my surgical career actually, um, I I believed that hormones caused breast cancer,
Yeah.
and I would completely disregard the people's complaints when they came to me after breast cancer treatment because once you have a breast cancer diagnosis and have a breast surgeon, you see said surgeon forever because you don't really trust anyone else to examine your breasts.
Mhm.
And so, women who were a few years out from breast cancer, and if you weren't menopausal when you got breast cancer, they for sure made you menopausal afterwards and then some. Because even if you were postmenopausal, the majority of women get recommendations to go on aromatase inhibitors.
Right.
And these drugs, these very, very powerful drugs, bankrupt your ability to make estrogen and they take away all of your circulating estrogen. And I'll tell you, that is a nightmare. Estrogen is the hormone of life. So
Mhm.
when you have no estrogen, you can't think, you're depressed, you can't sleep, you're anxious, you have these like repeated thoughts, you cannot find your words, you walk into a room 20 times, can't remember why you went in there, you have gut problems, you gain weight, uh, your joints hurt, your bones hurt, you have horrible pain, vaginal atrophy, repeated urinary tract infections, repeated yeast infections, no libido, problems connecting with people. I mean, these are really, really, really serious side effects. And people would come in and tell them to me. And I would say, well, at least you're alive. Thank God you're alive.
Yeah.
And I am horrified by my behavior. Horrified.
It takes a
And
big
yet,
person to admit that, though.
but
And
this is
it's very
happening
admirable, but
still
it is. And
all
so
the
many people
time.
are not doing what you're doing and shifting and getting rid of that ego and acknowledging that they don't know what they don't know and being more open. That's what's so infuriating. It's like we've all make mistakes. And again, we don't know what we didn't know, but you saw a change, like a light bulb went off for you. And why is that not happening?
Yeah.
And women are continuing to struggle and getting dismissed left and right.
hmm And
Oh,
still, I mean, still any woman with a history of breast cancer is told that she cannot
they
go
can't go
on
on it.
hormone replacement. And yet there is irrefutable data out there
Mhm.
that hormone replacement after a breast cancer diagnosis does not increase your risk of having a recurrence. And in fact, because of all the protective effects of hormones, these women actually do better, have better longevity. They have less Alzheimer's, less osteoporosis, less cardiovascular disease. And these are the major things that people die of.
Yep.
These are the life threatening illnesses. So, getting back to where we started, should people be afraid of breast cancer? Yes, I get it. But you should be equally afraid, if not more, of cardiovascular disease, of osteoporosis. As many women die every year as a complication of a fracture from an osteoporotic fracture as do of breast cancer. And I don't think that we're talking about that enough. I don't think that
Yep.
people realize that enough. And a great thing to protect your bones and protect your bone health is estrogen.
Mhm. Oh, we love
So
estrogen here.
yeah. Yeah.
Yeah, I'm team
So,
estrogen.
but I don't know if I would have made that shift had I not. I mean, menopause killed me. Every single symptom, every single possible symptom that you can have from menopause, I had and didn't know what it was. So
Right.
I was that typical person that, like, I was having dizzy spells, went to the neurologist. I
Mhm.
was having all of these palpitations, went to the cardiologist, had that huge cardiac workup, had a huge neuro workup. And they're like, we don't know what's wrong with you.
Yep.
Well, what was wrong with me was that I was going through menopause.
Mhm. Losing your
And
hormones.
yeah, yeah. And I mean,
Mhm.
literally everything that happened to me with gusto. When I tell you that I did not go quietly into my good night, I did not go quietly into my good night. And I would
Wonderful.
literally, talk about hitting rock bottom.
Yeah.
I mean, I was at my wit's end.
Mhm.
My husband and my children were like, which monster is going to show up today at
Yeah.
home? I would literally walk into a room 20 times. couldn't remember why I went in there. I'm someone that I could recall everyone's name from 100 years ago. I could recall everyone's name, and I would look at people and be like, nope, no idea.
Yeah.
I mean, it was awful,
It's
awful,
terrifying.
terrifying,
Yeah.
terrifying. Like you literally feel like you're losing your mind.
Yeah.
I couldn't do simple math. I was a cashier in college, so
Mhm.
like I can make change on a dime.
Yeah.
I I couldn't do
Couldn't do it.
simple math anymore. Like I would be using a calculator to add up 17 and 34. Like it was just ridiculous.
Yeah.
And I had a dear friend who said, "Why don't you go on hormones?" And I was like, "What are you talking about? Hormones cause breast cancer." Here I am,
Mhm.
like one of the country's experts on
Mhm.
breast cancer. And this is what I was saying.
Yeah.
And she said, "Have you read Estrogen Matters by Avram Blooming?"
Yep.
And I'm like, "No, I never heard of that book."
Mhm.
And I spent like that weekend I think I read it like 3 times that
Wow.
weekend. Like,
That's a hard book to get through.
oh my God. I just and that was it.
Yeah.
That was it. So I do credit Avram Blooming for saving my life and my friend.
Yeah.
Um, and now I'm on an absolute mission for people to understand that hormones are the elixir of life.
Mhm.
And when we don't have them, we're dying. We're literally dying. And it should be all of our goals to live as long as possible, but die young,
Mm.
right? Die young
Mhm.
like they do in the blue zones,
Yes.
where they are living life to its fullest to their last day. And my friend JJ Virgin says her life's goal is to be relevant at 100. And I have
Mhm.
no doubt that she will be,
Yeah.
because I mean, she
Absolutely.
is rocking 60 like no one's business. But, you know, you can't do that if your brain doesn't work and your heart doesn't work and your gut doesn't work. And it's just, you can't do it.
Mhm.
And so many people that think, oh, I'm not so symptomatic, I don't really need that. These internal changes are happening whether you feel it or not.
Yep.
And I really don't think that there's anyone who we shouldn't consider for bioidentical hormone replacement. I really don't
Yeah.
think that there
I
is
agree.
anyone who we shouldn't consider. Um, because we need it. We need it for every part of our body. I mean, there's a reason why we have hormone receptors everywhere. It's
Mhm.
because our body needs it.
Can you speak to that a little bit? Because this is a question I'm sure you hear all the time, and I hear it a lot. I actually just heard it from a recent client. She has a history of breast cancer. And of course, they said, it was estrogen receptor positive, progesterone receptor positive.
Mhm.
She's actually on HRT. She was just like, I'm going to do it anyway. And I was like, I'm glad you're on it. I'm happy to share resources with you, but she still has that fear, and her doctors have fear around it. It was
Yeah.
not easy to get. So can you kind of just explain as simple
Yeah.
as simply as you can, like what that means and why that doesn't mean that hormones cause the
Yeah.
cancer?
Yeah. So, um, let's just back up and say that when you look at normal breast cells, they have estrogen and progesterone receptors on them. They're supposed to. That's how they listen to the signaling, right? Because the breasts have a real function, right? They're supposed to um, develop during the first part of the month. And if there's fertilization, they continue to go on and develop, right? Because they have to eventually feed a child. So, in order to do that, there's a lot of proliferation, there's a lot of growth, there's a lot of cells, reproducing to grow the organ and prepare it to go to work, right? And if there's not fertilization, then there's a different kind of hormonal structure, and those cells undergo regression. And this happens month in and month out, and unless there's a pregnancy, or if you run out of eggs and stop menstruating. So it's absolutely positively normal to have estrogen receptors on your breast cells. that they're supposed to be that way. When we have cancers, when we have something go wrong in the breast and we develop a cancer, and we can briefly talk about why that happens, because the breast is the canary in the coal mine. So our breasts are made up of 4 tissues. They're made up of the glandular tissue that makes the breast milk. They're made up of fat cells. They're made up of connective tissue that kind of holds everything together, and that's in a skin envelope. And fat cells are where we store our toxins. So even if you have dense breasts, everyone still has a lot of fat cells in their breast. And so if your glandular cells, if your neighbor is filled with toxins, what kind of effect is that going to have on you? I mean, it's going to have DNA damaging effects. And so, that's actually where cancers start. It's because the breast is the canary in the coal mine. And if you have a lot of toxins, they're getting stored in your breast and they're directly affecting the breast tissue. So, getting back to if there's a cancer that develops, if this is a hormone positive cancer, this is a variant of normal. It has retained some normal characteristics. It's not a bad thing. Right? It's actually a good thing from my perspective, because it means like this isn't so far gone. Whereas the cancers that don't have hormone receptors on them, the triple negative cancers or the ERPR negative cancers, these tumors tend to be more aggressive because they've really mutated from what a normal cell is like. So, just laying that groundwork, breast cancer is not caused by estrogen. That's not what's happening. Breast cancer is caused by some environmental shift that caused DNA damage in the cells, and then that damaged cell replicates. And essentially what's happening there is those cells are going into survival mode. Right? And so what happens why do you go into survival mode? Because the environment is threatening. So breast cancer is without question an environmental disease. So the estrogen that we're making in our bodies, at least, our endogenous estrogen, this is not causing breast cancer. It's not. It's simply not causing breast cancer. And if you think that estrogen causes breast cancer, then you also have to believe that every woman was put on this earth for the purposes of developing breast cancer. It's absurd.
Right.
It's absurd. And if estrogen caused breast cancer, every single woman would get breast cancer, but they don't.
Right.
If estrogen caused breast cancer, why wouldn't we see it in the populations that have the most estrogen? Why wouldn't we see it in teenagers? Why wouldn't we see it in pregnant women who have 10 times the amount of estrogen? Now, I'm not saying we never see it in pregnant women, but I can tell you in the thousands and thousands and thousands of women that I've treated for breast cancer over these last, 2.5 decades, I've had 5 women who were pregnant. 5.
Wow.
It's just, it happens, but it doesn't happen frequently. So we really have to rethink that whole thing. We have to unlearn estrogen causes breast cancer because there are estrogen receptors on some tumors. It's just not true. Now, do they have an upregulation? Yes, that's a mutation that's there for the purposes of survival. But association is not causation. And I feel like we use these rules when they're convenient for us. And the truth is that there are estrogen blockers. And so they love this explanation because it fits with their narrative and sells their drug. But it just doesn't happen to be true.
Yeah.
And the truth is that there's a form of estrogen called estriol that will bind to the beta receptors on breast cells and cause them to undergo degeneration and apoptosis and programmed cell death. So we could use estrogen to treat these, But because that is a molecule of nature and you cannot copyright a molecule of nature, no one's going to do that because there's no money in it.
Mm-hmm.
Right? So instead, we come up with these synthetic estrogens like tamoxifen,
Yeah.
and we use them because it fits the narrative and fits the pharmaceutical kind of paradigm. And meanwhile, synthetic estrogens are a problem.
Yes.
And if tamoxifen is helpful in the breast, it's not so helpful in the uterus. And we see uterine cancer from people taking tamoxifen.
Wow.
So, you know, we need to be far more aware of the facts, and they're being shielded from
Yeah.
us. And that is another reason why I wrote my book, because people don't have the opportunity to make informed decisions unless they're getting the information they need in order to make those decisions. So that's why I wanted full transparency and to give people this information that they needed. But there is no question about whether or not estrogen causes breast cancer. It does not. And even in the Women's Health Initiative study, where they said that they saw an increased incidence, although not statistically significant, of breast cancer with the combined pill, the Premarin,
Right.
which is equine estrogen combined with a progestin.
Mm-hmm.
So both synthetic, non-bioidentical forms. That, though they saw that in the estrogen alone arm, which is the conjugated equine estrogen. So still synthetic, not bioidentical, but in the estrogen alone arm, they actually saw a decrease incidence of breast cancer. So, that whole study was so damaging for so many reasons, and the outcomes were so manipulated and absolutely positively false and did so much harm over the years. But the other interesting thing that we saw from that study when we looked 20 years later is that not only are you not at increased risk of breast cancer, but actually, even the people that got breast cancer while on hormone replacement, they had better outcomes. They had better outcomes as opposed to the people that got breast cancer and were not on hormone replacement.
Yeah.
And I think that is very important information that we need to remember. When all of the prescribing stopped after that study, and we had like an 80% reduction in the number of women taking hormone replacement, could be even higher.
Wow.
Did our incidence of breast cancer go down? No, it did not. It only went up.
Mm.
And it's interesting because women who take hormones get breast cancer. Women who don't take hormones get breast cancer. And after breast cancer, women who take hormone replacement have recurrences and women who don't. But the women who have recurrences on hormone replacement actually do better. So on both sides of it, pre-diagnosis and post-diagnosis, the women on hormone replacement do better.
And I imagine
So
have a better quality of life.
much better quality of life.
Yeah.
That's actually the next phase of my practice, is that I'm going to be working mostly with women who have recovered from a breast cancer diagnosis and are told that they cannot go on hormone replacement. I'm changing that paradigm. And I am actually going to focus my practice on the women who have recovered from breast cancer and want to have quality of life for the rest of their life.
Yeah.
Because right now they're being told, like, just be happy that you're alive, right? The
Mm.
same thing that I said to my patients for years.
Yeah.
But it's hard to be happy that you're alive when you can't sleep, when you have brain fog, when you're depressed, when you're anxious, when you have gained 10 12, 15, 20 pounds, when you have a tire around your waist, you don't feel like you, your joints ache, your bones ache, you have palpitations, you're getting chronic yeast infections, getting chronic urinary tract infections, have incontinence. I mean, this goes on and on.
Mhm.
And it's hard to be happy that you're alive when your life sucks.
Yeah, miserable.
And this is not uncommon. This
Right.
is not uncommon for women. And it's really time that we change this whole paradigm because, first of all, breast cancer patients are people too. And we
Mhm.
would never tolerate all of this in someone without a breast cancer diagnosis. You would never say to someone without a breast cancer diagnosis who came to you with all of those complaints, just be happy you're alive,
Right.
right? I
Mhm.
mean, you should be met with a punch in the nose for that,
Mhm.
right? Like that is just horrible, horrible patient care. And yet we think it's acceptable in the breast cancer population. It's
Right.
awful. So I'm changing that. So I have like not too lofty goals. I'm going to change that.
Yeah.
And it's the
You
title of
are.
my
You
next
already are.
book called The Forgotten Woman.
Mm.
And
Awesome.
I'm changing how we're screening for breast cancer because
Can you
for
speak to
years
that a bit?
and years and years, yeah, absolutely. I mean,
How should
we've
we be
been,
screening, and a little bit
yeah,
about mammograms, because that's another thing, I every woman thinks, well, you hit 40, you got to go for your annual mammo. Well, you have a
yeah,
different take on that. So,
yeah. Well, that's a mammogram that's been firmly put into place for a long time. And I understand why. I mean, first of all, it's really working,
mhm.
right? Like we do 37.5 screening mammograms every single year, and it's feeding the system and it's working. It's working for the system. Who
Mm.
it's not working for are the participants in the system. It's not working for the patients.
Mhm.
Now, when the mammographic screening program started out in the 1970s, it really did start out with the best of intentions because they firmly believed that finding things early would make a considerable difference. And mammogram was their way that they were going to find things early. But the whole program is based on this foundational belief that breast cancer growth is both linear and predictable. So if you could find something small, you could change the trajectory of that person's illness. And it's a lovely theory and logical, just doesn't happen to be true. Breast cancer, unlike other cancers that are predictable, like colon cancer, breast cancer growth is neither linear nor predictable. And what breast cancer is, it is from the beginning. So if it's going to be an aggressive process, it's an aggressive process from day one. So if you find a tiny little aggressive process, it doesn't matter because it's really systemic from the start.
Mm.
So it doesn't matter that you found it when it was really small because this is aggressive disease and it's going to act like aggressive disease. And on the converse, there are breast cancers that you may find very small, but they wouldn't have amounted to anything anyway. And the problem is that when we identify these women, we obligate all of them to treatment.
Mm.
So there are a number of studies out there that are based on hundreds of thousands of women. I'm not talking about small sample sizes. I'm talking about like 600,000 women, 100,000 women, not small sample sizes. And the results are the same again and again and again. There is no survival benefit to screening. No survival benefit. No matter how many mammograms we do every year, the same exact number of women die of breast cancer. We are not impacting the bottom line. What we're doing and what these studies have shown time and time again is that if you diagnose more cancers, you treat more cancers. That's true. But the same number of women die of breast cancer, whether you screen them or not.
Mm.
So, those women who you think you're picking up the disease early and saving them from a breast cancer death, it's just not true. So, for that extra 20 or 25% of women who were treated for breast cancer in the screening arm, those women would have never developed clinical disease.
Okay.
So, we're treating all of these women for breast cancer that don't need to be treated. And the problem with that is that our treatments for breast cancer are not benign.
No.
They're not. And they increase your risk of cardiovascular disease. They increase your risk of Alzheimer's, of neurodegenerative disease. They increase your risk of osteoporosis and osteoporotic fractures. And not for nothing, but they really decrease your quality of life. I mean, if you are in pain, if you don't feel well, your life suffers, really suffers as a result, and every aspect of your life suffers as a result.
Yeah.
So by treating women for breast cancer, we are decreasing the quality and the quantity of their lives. And this is a huge problem. And especially if we're not increasing survival from breast cancer, which we're not. So mammogram is a huge problem for me. And it goes well beyond the fact that they're painful and it's an awful test. I mean, it's barbaric.
Yeah.
But if it saved lives, women are tough. We can do just about anything if it means that it's for the good, right? But if it's not for the good, what are we doing?
Right.
And we should have abandoned it long ago, even when there wasn't an alternative. We should have abandoned it because we've known for decades that it doesn't save lives. And, there are staunch supporters of mammogram who, I mean, they're going to, that is the mountain that they are going to die on. And, sadly, I'm like, bye-bye, like go die on your mountain because it's done. It's done. The time of mammogram is over. And thankfully now there is a solution for the women that want to screen. So now I personally believe that everyone should be doing self-breast examination. I really believe that. And it's been demonstrated that screening with mammogram is no more effective than screening with self-breast examination. In that you will definitely find things earlier, but the earlier things that you find would have presented if you're doing self-breast examination and presented in a timeline where it was still equally as treatable. Because the not treatable things are going to be not treatable no matter what.
Yeah, I think that's some women's fear around that is like, oh, well, if I wait, it's going to be too late to treat it. And you just said
so the
that's not
data
the
says
case.
otherwise. The data says that it's only a difference of 5 millimeters that between when mammogram would pick it up and when you would pick it up on physical examination. And that's a meaningless number in terms of size, right? And I will tell you that this is one area, size does not matter. It just doesn't. It just doesn't. Biology is the only thing that matters with tumors. Size does not matter. So I do firmly believe in self-breast examination. And I also think that no one is going to know you better than you know yourself. So if you have an awareness about your breasts, you're also going to have a general awareness about your health. So
you would hope so. I mean, I think, again, going back to what we were saying earlier, our body speaks to us. Stop ignoring it. That's the problem, I think, with so many of us women is like we ignore it because it's like, oh, I'll take care of it later. I have to take care of everybody else first. Then I'll take care of myself.
For sure.
We can't afford to do that.
I agree 100,000%. But it's time, right? Because we have to take care of ourselves. We have to advocate ourselves. We cannot be farming out our health to people who your doctor, as lovely and caring and wonderful as your doctor is, that person is still going to go home to their home at night and they're not going to care about you as much as you care about yourself, I hope. And for most things that certainly the things around health, your doctor doesn't know. If your doctor knows, that is a very, very exceptional physician and cling tight to them.
Right.
Because
somebody who actually went for further education like you did.
Yes. Because most doctors have no idea how to get people healthy and keep people healthy. No idea. Right? Like eat less, exercise more is about all they know. And we know that that doesn't work, right? If eat less, exercise more worked, you and I would be out of a job.
Right. Right. Especially not for
So
perimenopausal women. Oh
no,
my gosh. I mean, so
no.
many women, that's what they're doing. And
Yeah.
that's why they
Yeah.
feel
Let's be
lousy.
clear. That's the worst time to eat less and exercise more, right? Perimenopause is not the time to pile on your stress. And that's exactly what that does. Eat less and exercise more is just piling on the stress to a body that's already saying, hey, I can't take it. I can't take it.
Yeah.
So self-breast examination, definitely once a month. If you are menstruating regularly, then it is 1 week into your cycle. So 1 week after the first day of your period. If you are postmenopausal, then the first of the month. Feel them on the first, right? But most people, that it doesn't make them feel comfortable. They're afraid they're going to miss something. It's not right for them, whatever. QT imaging is this revolutionary test that is painless. There's no compression. It uses sound waves transmitted through a water bath, so there's no radiation. It collects 200,000 times more data points than MRI, so highly sensitive. It creates a true 3D image of the breast, so highly accurate. And the amazing thing about it is that it has functional capabilities. So right now, 3/4 of the breast biopsies that are done for benign disease. So only 1 in 4 women that are biopsied actually have breast cancer, which means that 3 out of 4 women biopsied didn't need a biopsy at all. But once you ring that bell for a woman, it's kind of like she never gets over it.
Yeah.
Right? Like it's so devastating.
Yeah.
So I think we need to eliminate a lot of unnecessary biopsies. We've already spoken about the fact that we need to eliminate that overdiagnosed, overtreated group of women because we're really hurting them. And we're talking about hundreds of thousands of women that we're doing
That
this
are
to.
Yeah.
Yeah.
I saw that in your
Yeah.
book. And
Yeah.
I mean, it's mind
It's
blowing.
frightening. And so with QT imaging, if we see something, now listen, if it's an obvious cancer, that person gets treated for cancer, right? Like this isn't saving everyone. It's identifying the people that actually need to be treated while not hurting them, right?
Yeah.
Because mammograms are still radiation. They may be low dose radiation, but it's still radiation and it's still building up year after year. And there is no doubt that they are causing a percentage of breast cancers. I don't know how many, but they are definitely causing a percentage of breast cancers. So with QT, if you see something, you can bring someone back for a short interval study, like 60 days, rescan them, count the cells, and measure a doubling time. And we know that cancers have a doubling time of less than 100 days. So those people, we know that they have a lesion in their breast that needs attention, and we send them for treatment. And for the women that have greater than 100-day doubling times, we tell them we'll see them in a year and we just continue to follow them. And there's no danger because this test is 100% safe. There's no radiation, there's no gadolinium, there's no contrast, there's nothing. There's no compression, so there's no trauma. I mean, literally, your breast goes for a 20-minute swim. That's what's happening, right?
Yeah.
Each
Much more
breast, 10
appealing
minutes,
than being
10 minutes in the
squashed
pool
by
for each
metal.
breast, right?
Yeah.
Yeah.
Wow.
So it's a perfectly lovely experience. And then we can save all of these women from having biopsies that don't need to be biopsied, from being treated for cancer that don't need to be treated. So is it a perfect test? No, there is no perfect test. But that if we're not hurting people, and this is the most sensitive test that we have, and we are not going to overdiagnose and we're not going to overtreat, I, to me, that's pretty good. And that's
Yeah.
worth changing the system for,
Yeah.
because
I
what we
agree.
have now is not working, and it is definitely hurting people.
Mhm.
Definitely hurting people. Hundreds of thousands of women suffering every year unnecessarily because of mammogram.
Yeah.
Yeah. So, yeah. So, you know, not too lofty goals. I'm just going to change the way that we diagnose, treat, reverse, and screen for breast cancer. That's all.
Yeah, you're very courageous because I imagine you get a lot of kickback. And I mean, I
Mm.
kind of look at your social media sometimes. I'm like, oh,
Oh, yeah.
the way
I have
people
some
answer.
haters.
I mean, oh, yeah. I mean, social media is just a breeding ground for haters, but
Yeah. I have
especially
some
when you go
haters for
against the
sure.
grain.
Yeah. It's okay. It's
Yeah.
okay. Because, you know, I was talking to my best friend over the weekend, and I said to her, like, how do you handle that?
Mm,
Because she's also in a profession where a lot of people disagree with what she does. And she said, I just pray for them,
mm,
because there's going to come a time when they realize how wrong they are.
yeah.
And so I just pray that they're not too hard on themselves when they realize that.
Yeah.
And so I won't tell you that, you know, there aren't times when people get me going and get my goat. And I don't like to be called dangerous. And I don't like to be told that I'm killing people, because I know that that couldn't be further from the truth.
Mhm.
Um, and I am someone who has lived a life of service and sacrifice without question. So, you know, I won't tell you that that doesn't get to me. But at the same time, I'm 100% positive that this is what God meant for me to do. And I look to God every single day to give me
Mm,
strength to get through. And it is helpful for me to pray for these people,
yeah.
because I do know that there's going to come a time where these people are going to look back and say, like, oh my God, I can't believe that
Mhm.
that I did that.
Yeah.
And listen, I can't count on how many mammogram prescriptions I've written in my career.
Mm,
I can't even count. So listen, I did it too. And I was there too. And for a very long time, I believed that we should screen everyone with mammogram, and we should screen them often.
yeah.
So, you know, I was right there. And I was so lucky to have my blinders removed.
Mhm.
And that is my response to a lot of people now is, you know, when they come at me, I just say, like, I can't teach the blind to see,
Mm,
but what I can do is help the people with their eyes open to get where they want to go.
yeah.
That's their fear talking. So I know,
Mhm.
like, there's a particular radiologist that she is just trolling my page
Mm-mm.
every single day, waiting for the thing to pounce on.
Yeah.
And I know that this is just her fear.
Yeah.
Like, am I missing something, or is this a threat to my livelihood, or,
Mhm.
you know, am I really doing the wrong thing? Like, it's making her question herself. So she comes at me with such full force, and
Wow.
mammogram is the gold standard, and yeah. And you know, all I can think of is that Shakespeare line, like, methinks thou dost protest too much.
Mhm.
Like,
Yeah.
it if you were right, you shouldn't be so upset.
Mhm. Yeah. What are you
And
trying to prove?
yeah, yeah. And it's like the yell louder thing. Like, if you write it in all capitals, it will negate
Right.
everything that I say.
Right.
So
No.
yeah, just pray for them. Just pray
Yes.
for
I'll
them.
pray for you because it's
Thank
not
you.
easy doing this
Thank
work.
you. Thank
And
you.
I admire you and anybody who goes against the grain. I mean, it's very admirable and courageous. So thank you for everything you do.
Or crazy.
Or crazy. A little, I think we all have to be a little crazy
A little
to go to do
crazy.
that, right?
A little
To go
crazy.
against the narrative.
Yeah.
Yeah.
I know that it's so important. And and we really have been collectively suffering for a long time,
Mhm.
and things are not getting better. They're getting worse.
No, and that's it's very it could be very discouraging even, just doing what I do when I feel like there's so much out there in terms of education and all the different diets and so many ways to support your health, yet
Yeah.
things are getting worse and worse. And it's like, is it overwhelm? Is it the fact that we just live in such a toxic world that it's like you're just swimming upstream where it's
Yeah.
like you can try
Yeah.
all these things, but there's just constant like toxins and stress and distractions, even politically now. It's just like, oh my God, it's like one more thing, one more stress in our lives.
Yeah.
And
Agreed.
it's hard to be healthy.
Yeah, it is. Um, and just like on our own individual journeys, we really have to hit bottom before we change. It's the same thing happening in the world.
Yeah.
It's like we're just going to have to completely fail before we take another direction, which please God, it should only happen that we take another direction, but
Yeah.
we'll see.
Yeah.
Every time you think it can't get worse, it does.
I know.
So, yeah. Yeah, well, it's focused on the wrong thing, it's priorities in the wrong place, and it takes the thing about change is that you only change when the fear of staying the same exceeds the fear of change. And
Yeah.
change is scary, and I think that that's a lot of the reason why I get so much pushback because people are so afraid to change the status quo.
Yep.
And it's a lot of the reason why, people go get their mammograms every year. It's because it's what they've always done and what they were told to do.
Mhm.
And they stop thinking. It's like they
That's
follow a
without question.
narrative.
Yep.
And I mean, I have to applaud my mother who most of the time is not super aware of things and what's going on around her. But she last night at dinner said to me, you know, those mammograms never made sense to me. I mean, they're x-rays. And my mother, God love her, is not a terribly deep woman.
Mm.
Like she doesn't often think about things like that. Yeah.
Yeah.
And I was like, wow, mom, that's exactly right. And she's like,
Mhm.
I don't understand why anyone does that. I mean, it's an x-ray after all. I'm like, yeah, that's correct.
Yeah.
So, y- you know, I, I do believe that there is a large audience out there who wants better, who
Mhm.
wants more, who wants to get healthy and do the things that drive health. And everyone else will eventually follow.
Yep.
Um, but the trailblazers are out there. They're
Mhm.
out there. They're listening to you. They're listening to me, and
Yeah.
they're out there definitely.
Yeah, I believe that. And, I've seen it even in my own life, just, years ago when I had wake up calls because I was like you. I was like, I'm not okay with these answers that I'm getting. Like, I want more. There must be something else. I went to Institute for Integrative Nutrition. That was the first school that I went to. And I also was in lectures and just like blown away by it.
Yeah.
And I remember even just becoming a health coach, like my family and friends were like, what? Like they were just like, what is that? What does that mean? And
Wait,
a
what is
lot of the
that?
things that yeah, like they're just like, I don't understand. Even
Yeah.
just changing my diet. It was like I was
Yeah.
the first one to do it. And everyone at first was very resistant because they don't like change. And it was like, well,
Yeah.
this is how we were doing things. And now, years later, like they're sending me stuff. And I'm like,
I know.
where have you
It's
heard
great,
that
right?
before? And
Yeah.
it makes me laugh, but it's like, I'm like, finally, because sometimes it's like you want that validation too for the work that you've done. And you're like, I'm not crazy, right? Like, somebody
Yeah.
please like see what I'm seeing here. And
Yeah.
yeah, so it's nice to see that shift. But we just got to keep fighting the good fight, I guess.
Yeah, that's exactly right. And just staying curious and
Hmm.
staying humble,
Yeah.
right? Like there every single day there's something comes up that a question that I get asked and the answer is I don't know,
Hmm.
but I'm going to try to figure it out. I'm going to
Yeah.
work hard to figure it out. And just realizing, you know, you don't know what you don't know and staying curious. Always being curious. I think that that is the biggest shift between the me then and the me now is that I am so curious all the time. I just want to know. I want to figure that out, and I want to know, and I want to know more, and I want to look at it from a different perspective. And um, one of my mentors is very famous for saying, if you're not embarrassed by something that you did 6 months ago, you're not learning.
Mm.
And I mean, I think that I'm even on a faster track than that, in that there are things that I'm embarrassed that I did 6 weeks ago, because I'm literally constantly working and
Yeah.
constantly honing my skills and being better and doing more. And I think it's really important.
Yeah.
And a big part about conventional medicine is that they lost their curiosity.
Yes.
And they think that those answers are always the answers. And they may have been answers then, but they're not now.
Mhm.
Not.
No. Well, thank you. This was an
My,
amazing conversation. I
my
could have kept
pleasure.
talking for hours, but I'll be mindful of your time. So whoever's listening or watching, make sure you grab this book, whether or not you have breast cancer, or I just think it's phenomenal. Even just getting into diet and how to take care of yourself. I love how you talk about nurturing yourself or nourishing yourself. And it's not just about your diet. It's not just about movement, ladies. It's about finding work you love, having really great relationships, just being fulfilled in life, finding joy, getting sunshine on your face. I mean, all the things that I preach about, but um, from her perspective. So I really recommend the book. And women can find you. I'm going to put all of your links and whatnot in the show notes. But you work with women, correct? Do you want to just share a little bit about how you work
I
with women?
do. I do. So my medical practice is called Real Health MD. And there we help women at any stage or phase of their breast cancer journey. So I just put my Real Health
Oh,
MD
cool.
logo up here.
Mhm.
Um, and so we have both group programs, and I work with people individually. And that is where the new Real Health Restoration program will be for women who are looking for hormonal health following a breast cancer diagnosis. And then, of course, my book that you just talked about, The Smart Woman's Guide to Breast Cancer, is available on Amazon.
Mhm.
I have my own podcast. It's called
Oh, yeah.
Keeping Abreast with Dr. Jenn, and we hope to have you on very soon.
Oh, thank you.
And that is wherever you find your podcasts. And I feel like I'm forgetting something. Oh, yes, of course. Perfection Imaging is
All
opening
right.
in Haverford on
Okay.
August 26th. So
Okay.
if you just go to perfectionimaging.com, and perfection is spelled with QT in the middle, then you can schedule your exam. And hopefully that will be the first of 50 perfection imagings that I plan to open. So I'm going to be quite busy for the next 5 years, but it's all
Right.
good
Yeah.
because it's really important. And again, my mission is to change the way that we diagnose, treat, and screen for breast cancer.
Yeah. Well, thank you. Thank you so much. You're incredible.
Thank you.
All
Thank you so
right.
much for
Thank
having
you.
me.
Of course. All right, ladies, check out the show notes for all the info and make sure you follow Dr. Jenn Simmons.
Oh, yeah.
Thank you.
Dr. Jenn Simmons on all the different
Okay.
social media platforms. And my Jen has two N's.
Yes. Thank you.
Bye for now.
Hey, before you go, if you're ready to get educated, empowered, and feel your best in your peri years and beyond, grab my must-have guide for women 40 plus navigating hormone changes via the link in the show notes. You'll learn my top 5 strategic diet and lifestyle changes to make ASAP to support your declining hormones and get back your energy, improve your mood, and confidence. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.